This project came about as a result of COVID-19. We received a lot of pressure from public wanting to look for a solution because there was no medicine.
The head of state contacted us here as an institution to find out whether we knew anything in nature that could support fighting against COVID-19.
We came out with a number of products and we narrowed on the UBV-N, which is a product from the community which has been used for some time.
Ugandans were had attitude problems regarding herbal medicine. The very first thing one thinks about is witchcraft. So, we are in the system in the Ministry of Health, but we are being taken as nobodies. Now COVID came in to open people's eyes the world over. We know that most of the medicines imported in here are from natural products, but here we were in a country where people don't appreciate. So we were really happy to see that now was an opportunity for us to show that yes, we can have something from nature. WHO, as you hear it, World Health Organization, it deals with a diversity of health issues, those to do with Western medicine, diagnostics, and traditional medicine. So whatever we do as a WHO member country has to follow procedures they've put in place. For example, we had to follow guidelines they've put in place. Some of them were new because of COVID, so they had to come as monitoring, as part of a monitoring exercise in several countries, not only Uganda, because they visited others as well, especially those that ventured into clinical trials. They've come to meet us, interact with us, and share successes and challenges.
They have come here to learn how we went through. I think the best thing they can do is to see our experience. What are we going through in conducting the study? How do we conduct it? And what are the challenges we faced with? And I think they have learned it. It may be different from other countries, but they will take a lesson from us, how we conduct a study on such a natural product which was being used against COVID-19. Uganda is going to benefit because once they go back from here, using that experience, they are going to formulate possibly guidelines which will help improve their guidelines for studies on natural products. And using that, they can help us, Uganda can benefit because our experience has been used to develop guidelines.
So we're going to really benefit a lot, especially in capacity building, because they've mentioned how they can support in issues of developing curriculum, issues of having what we call pharmacopoeia, institution of IT systems. We need robust ICT systems so that we can have quality, well-protected research data. They're going to support us in terms of having